Hi, everybody. Thanks for joining us. For those of you who don't know me, my name is Peter Llewellyn. I run the activities at MedComms networking.com. So I try and facilitate information sharing, discussion, people to make contact with each other across the global MedComms business, across the globe, so across medical education, medical publishing, medical communications, and so on. The great thing about these webinars that we're running is we can get people involved from all over the world. And we've got lots of people indeed today involved from all over the world. So thank you very much for joining in. And we can invite speakers from across the business to talk about different aspects of what we do. And today I'm running a series of sessions about listening to the patient voice. I'm absolutely delighted to have Dawn and Trishna and Simon with us. I'm essentially going to shut up and let you take the floor. Dawn, thank you very much for leading this. You're going to guide us through a discussion on basically the involvement of patients in scientific conferences and so on. Audience members who are with us today, please do add your comments and questions into the box. But over to you, Dawn. We've got half an hour or so to have a chat about what I think is a very, very important topic. So over to you.
Great. Thank you so much, Peter. So for those of you who don't know me, my name is Dawn Lobban. I am a co-founder at Amica Scientific. We are an agency that specializes in integrating medical and patient engagement. And I am delighted to be joined by two fantastic colleagues today who I will ask to introduce themselves in a moment. But before we get to that, I just want to kind of set the scene on what we're talking about. So as you know, Peter mentioned, it's a really important discussion to have when we think about patient involvement across medical communications, to think specifically about what's happening when it comes to scientific congresses. And I know many of you who are listening today will regularly attend scientific conferences, and hopefully you will have seen that there has been an increasing involvement of patients over recent years. And that's not just thinking about patient tracks that appear at conferences, but also thinking about patients being visible on the podium, contributing to scientific discussions on the podium, sharing scientific data, co-authoring those abstracts and data, and also thinking about patients who are attending the conference having access to some of the data through plain language summaries, for example. So I'm sure many of you will have started to notice some of these changes. So what we want to explore today is really, things are changing, but how well are we doing? Are things changing fast enough? What are the opportunities that we're starting to see? What are some of the barriers that are preventing this happening even faster? A little bit about who's attending these conferences, who are these patients, why are they attending these conferences, and what can we do as a MedComms community to really drive best practice moving forward. So with that, I am delighted to introduce Trishna and Simon. I'm going to ask each of them to just tell us who they are, but also a little bit about their experience of attending conferences. So Trishna, would you like to go first?
Sure. Thanks, Dawn. So hi, everyone. I'm Trishna Bharadia. I'm a patient advocate and patient engagement professional. So I've been working in this space for about 15 years, and I work with multiple stakeholders within healthcare and medicines development. So you're talking about pharma, medcoms, CROs, publishers, patient groups, you name it, I work with them. So I'm also a visiting lecturer in patient engagement at the Centre for Pharmaceutical Medicines Research at King's College London. And amongst the various roles and hats that I wear, I'm also the co-chair of the Working with Patients and Communities Forum at the Faculty of Pharmaceutical Medicine, where I'm an honorary member. So I work in three main areas. So one is patient engagement strategy and the design and delivery of patient-focused projects. Also equity, diversity and inclusion in healthcare and research. And then also patient involvement in health information and scientific publications. So I'm really fully embedded in patient advocacy and engagement. So Dawn, you mentioned experience in terms of scientific congresses and conferences. Well, when it comes to scientific congresses, so I've been a speaker in sponsored sessions, I've designed and delivered satellite events, I've co-authored and presented research posters, And I've also attended specific patient days, which have been part of a congress. But then with other types of conferences, so if we weren't talking about ones which aren't specifically scientific congresses, there's other types of conferences and meetings where we're looking a bit wider. I've also sat on planning committees. So, for instance, I've sat for a number of years on the ISMAP European Meeting Planning Committee. And that particularly is a role that I actually really, really enjoy. And I'm sure Simon will talk a little bit about that as well with his experience, because you have the opportunity to really shape the conference content, the scope, and really have an impact on what it is that the attendees and the delegates are actually going to learn and hear about.
Brilliant. Thank you so much, Trishna. And Simon, do you want to introduce yourself and tell us a bit about your experience?
Well, it's a very hard act to follow when Trishna introduces herself. That's because she's so experienced. So I'm feeling a little bit inferior now, but I think we're
Now you're
great.
making me sound old, Simon.
Absolutely not. So, hi everybody, I'm Simon Stones, and first and foremost, I'm a patient advocate. So, I've worked in patient advocacy for around 12 years now, and started out as a young person involved in research, which back in 2012 was really, really difficult because we've come a long way, I think, as we will see throughout today's discussion. So I'm very active within the rheumatology space, and I'm currently the chair-elect of the EULAR PARE committee. EULAR is the European Alliance of Associations for Rheumatology, and they had the patient representation committee. So I'm really privileged to be in the role of chair-elect up until June next year, when I will take over as chair. And I will be touching quite a bit on my experiences with EULAR, because it really is a great example of how you integrate patients, not just on the side and on the periphery, but as an embedded part of a medical community. And we are seeing that evolution of patients from being on the side to being truly integrated, which is where I think we need to go. I've also had the privilege to work with a number of pharmaceutical companies and agencies over the years as an independent consultant, and then more recently as a medical writer. And I have, for the last 2 weeks, joined a new agency, Amica Scientific, with Dawn and Anne-Claire Wadsworth as a scientific director for patient engagement. So it really is. It's the ideal role for me, because I'm able to blend that patient advocacy experience, which is where my heart is, and it is that experience of working with patients day in, day out, in various different roles still, whilst also blending that experience as a medical writer, and really bridging the gap, and you know what, realizing that everyone brings unique expertise. And I was at a patient meeting last week, looking at rheumatology from patient perspectives with over 120 individuals, and we're really reshaping that narrative where patients are seen as individuals with expertise, and it's really how we bring all of that together to really advance what we're trying to do as a community to make people's lives healthier and happier. So really looking forward to our discussions today.
Brilliant. And obviously, I'm delighted to have two such experienced panelists, because it makes my job as a moderator much easier. But before we get into thinking about what's happening at these conferences, I just want to explore, when we're talking about patient involvement in conferences, thinking about who we're talking about, because you two are obviously very experienced and very involved. But what we're actually seeing is the real increasing interest from patients, patient advocacy groups, maybe who haven't been involved historically, and a growth in that area. So I'm just wanting each of you to comment on why you think this is happening from the patient perspective. Why are people interested? And also from a pharma perspective, why should we be thinking about doing it? What's the value of getting patients involved in conferences? So maybe, Simon, I'll start with you. I'm just going to chop and change with who I start with.
Do you know what it is? It is about reshaping. Historically, medical conferences were for the medical professionals, the doctors, to be fair. And we've seen that evolution over time, where the allied health professionals, so nurses, physiotherapists, and the people of the multidisciplinary team have started to get involved. And we are at that next step where patients are starting to get involved. For lots of organizations, this is also not something that's new. I've seen examples where patients have been attending for 20 plus years to these meetings, But it is that shift away from this is just a closed society for doctors to realizing, okay, healthcare has changed and we are all part of a interdisciplinary team of experts. And when we're thinking about people who are attending, I often draw the parallel with, you wouldn't necessarily drag a first year junior doctor to a scientific congress, plunk them in the middle of the congress hall and say, right, okay, get on with it. And it is the same. We would not necessarily bring a newly diagnosed patient who doesn't know anybody, and wouldn't necessarily be able to feel confident to contribute in that scenario. So it is the same principle. Um, and so the people you are seeing attending these meetings are really, really experienced patient advocates, also caregivers as well, and patient organization representatives. And at some of these meetings, there are 300 plus individuals with that pooled experience. But that's not to say we should just only be including the same people that we sometimes see at these meetings. And I very much see that in my patient advocacy role as a opportunity for us as a patient community to equip our members and our networks with the skills and the confidence to be able to contribute to these meetings to bring those fresh perspectives into the discussion.
Great. And Trishna, any additional thoughts?
Yeah, so I have to agree with everything that Simon said. I think so. It's very much the patients who are attending these conferences and congresses. They're people who are engaged. They're people who are advocating for their communities. And I remember having a conversation. I've had multiple conversations around this, but I actually very recently had a conversation around so someone said if you're going to a congress or you're being involved in authorship, for instance, then you're just an NF1, you're bringing your own experiences. I actually know the patient advocates who are going to congresses, who are authoring publications, who are doing this high level of advocacy. We're not an NF1. We are representing communities. We're taking back the information that we learn and that we obtain from these congresses back to our communities, as well as representing the patient voice during the meetings itself. So we need to remember that, saying, oh, well, having a patient advocate there, how is that representative? It is because they are there as a representative of a patient community. And pharma and agencies should care about this because it's about educating the patient community. If you have a more informed community, then that community will be better able to participate in shared decision making. We have to remember that it's not all about what the doctor thinks anymore. Patients are partaking in shared decision making. They need to be informed about the medicines that they're being offered because they have input into whether or not they're going to take that medicine. So they need to be informed. They need to learn about their disease. They need to learn about the medicines. And one way of doing this is having patient advocates who are representing the community be able to bring that information back in language and in formats that are understandable to a much wider audience.
Yeah. Yeah, no, I absolutely agree. I think it's a strange argument about the N of one, given that it's exactly the same for a healthcare professional. They're still a single person, they're an author. Okay, so it sounds like there's a real clear rationale for patients to be attending conferences, both in terms of getting involved in medicine development as a process, but also as an end user to make sure that they can be involved in informed shared decision making. So when we think about as a community of MedComms professionals on this, listening to this, what are the opportunities that we're seeing? If somebody wanted to think about how can I get patients involved in what I'm doing at a scientific conference, what kind of opportunities are we starting to see? And maybe, Trishna, you can kick us off.
Yeah, sure. So a lot of those opportunities are essentially some of the examples that I've already given. So, things like sponsored symposium sessions, have patient advocates and patient organisation representatives involved as speakers, as co-authors on posters and presentations. I actually really like it when you have the opportunity to bring HCPs and patients together in the same sessions. So I've actually been involved in some really good discussions through an initiative called MS in the 21st Century. If you've not heard about it, Google it. There's a website. And it's a Merck, Darmstadt, not the other Merck, sponsored initiative. And it regularly has presence at congresses through sponsored sessions, through research posters. And you can get some really fantastic and rich discussions when you bring the HCPs and the patients together, because that's where you can truly see that this whole tradition of, oh, we won't bother asking the patients because the HCPs know what the patients are thinking. Actually, that's not true. So I really like it when that happens. And I also really like it when you've got patient tracks or patient involved sessions that are sort of distributed throughout a congress. So some have specific patient days, others have got patient tracks that run parallel to other tracks within the congress. And I think that's a really good start, particularly for risk averse organizations, in terms of starting to get patients involved. I actually think that patients should be involved in the organization and the planning. I feel like we shouldn't be stuck on the end of a congress, or, when everyone's going home, or at the beginning when nobody's arrived yet. So I think it's a start. I think there are some really good initiatives. And Simon, I think you're going to obviously speak a little bit about what EULAR does, where the patient voice is truly integrated and embedded throughout. And I think that's where we need to be headed.
Brilliant. And I think, it's great to see more and more of these opportunities coming through. And Simon, I know part of your role within EULAR is to look for these opportunities and to grow them. So do you want to talk a little bit more about that?
Absolutely. And you know what? A lot of the challenges we see starts with senior leadership buy-in. And, there's so much we can do from the ground up, and I'm very much of that mindset. But unless you've got senior leadership buy-in, then it's always going to be a challenge to get these changes to happen. And so EULAR, I think, is a great example whereby actually the board of EULAR has patient representation as one of the vice presidents. And then the whole board has patients at the forefront, and it is part of EULAR's strategy, patient-centeredness. So that really helps to pull through that the importance of patient engagement, not just through a tick box exercise, which we sadly still see way too often. And then that comes down to the Congress committee. So the way that EULAR is structured, there's patient leadership at various different levels. And from the patient committee, we are a leadership team, and then we are automatically part of the Congress committee. And so I'm part of that committee for next year, and it really does look at all the different steps along the journey. So having patients as part of the objectives of the meeting, involved in setting the agenda, reviewing the abstracts as well, involved in press releases in the different sessions, evaluating the meeting. And so it's really sort of intertwined all the way through that process. And I think, like Trishna said, we see some examples of separate patient days, and from my perspective, that's not the ideal, but I think the risk averse Congress organisers, it is a nice gentle ease in, and that can particularly be for organisations with maybe a smaller patient community or less of those links. Then it is a great way to start. So it's not to put people off from doing that, but I think the real gold standard is where you had them really integrated into the overall programme. With some opportunities for that separate discussion, which I think is important. These meetings are an opportunity for patient organisations to get together and to have those discussions in a safe and closed environment, but then to also realise that people are interested in the topics which patients are presenting. And I think sometimes there is the miscommunication or the perception that actually they're just talking about this nice, fluffy topics which often get associated with patient groups. Actually, we've seen examples of, really great research which is being delivered by patient organisations, collaborations with health professionals and industry, and patients are actually leading that work. So it is reframing that conversation about what is actually happening within patient organisations, and having those joint sessions. So we particularly love our joint sessions with between the patient community and the health professionals in rheumatology. So nurses, physios, occupational therapists, psychologists, and so on. They're often a overlooked group of individuals who've only more recently had their voice heard within a conference setting. But a lot of the work that we do overlaps around self-management, around psychosocial well-being. There's a lot of synergies there. But we're also seeing those joint sessions with our clinical and even basic and translational research colleagues as well. So how do we integrate patients into that perspective? And we did a sort of the digital health and AI session last year, and it was really, really interesting to have all of those different perspectives. And it often is just those conversations which spark a new light bulb moment, particularly within academic and clinical colleagues. And it is that opportunity. And I think we're also seeing newer kinds of opportunities at conferences. So we've got like meet the expert sessions. Sometimes it's a clinician, sometimes it's a patient organization representative. We're seeing escape rooms where we're getting everybody together to actually work on something completely separate, but then you are blending that expertise, that experience, and your networking. And that is, I think, a huge aspect of these meetings, that it's a great networking opportunity for the patients with each other, with our wider colleagues within a particular field, with industry, with publishers. It's a great platform to bring people together, and we really can't overlook that aspect.
And it's fantastic to hear there are all these opportunities. I think it would be a bit remiss of us not to also mention that there are some barriers, and it isn't all super rosy and easy to do. So I just wanted to touch on from each of you, maybe some of the barriers you've experienced and that you're aware of, and maybe thinking about how we can start to address some of these. So Trishna, if we jump back to you, do you want to just start and maybe talk about some of your experiences?
Sure. So I think for me, there's been three main barriers that I've seen in terms of patients being involved. So one is around accessibility, one is around compliance and aversion to risk on the part of Congress organisers and also pharma. And one is around the sort of the education and the training that patient advocates, patient organisation representatives need in order to be able to fully partake in these congresses and be able to obviously bring the information back. So in terms of accessibility, so even pre-COVID, but I think even more so post-pandemic, I think we need to be thinking about hybrid. We need to be thinking about how do we make this more accessible for a wider group of patients. So during COVID, when the vast majority of the world was in lockdown, we've already mentioned about how do we get different voices heard. I saw that when the vast majority of the world was in lockdown and everything was virtual. And now that the majority of Congress organisers and conference organisers have moved back to in-person only, I'm now starting to see what was happening before COVID, where you're just getting the same people. And that's often because travel might be an issue, fatigue might be an issue. For me, I live with several chronic conditions, and fatigue is a real issue for me. So it might be that I'm being asked to do, I don't know, a 1 hour session at a conference in, I don't know, Frankfurt. But actually that takes 3 days out of my time because I have to travel the day before. I'll do the conference session and I have to travel the day after because I can't do everything all at once. And so actually I then have to think about, am I going to be able to manage this, to be able to take 3 days out and then also have the pre and post, the preparation and recovery time. Cost can be an issue as well when it comes to accessibility. And then when it comes to, dare I mention, compliance, this aversion to risk, having to comply with local regulations can cause confusion, not being allowed in certain areas. We have to understand the type of patient advocate that is attending. And I think there needs to be sort of generally a move towards having codes of practice and regulations better reflect what the reality is in terms of recognizing that the types of patients who are attending these congresses are advocates, they are representing patient organizations, they are experts. So in this context, actually, they're usually there in a consultancy capacity. And we need to remember that when it comes to them being able to access all the areas that they need to access and make pharma and industry and the Congress organisers more comfortable with enabling this to happen.
Yeah, I completely agree. And Simon, anything you want to add to that?
I just really touch on the compliance aspect. And I think we do need to reframe the conversation with our regulatory colleagues on board as well. Because, if you register, and we've got health professionals who also live with the same condition that they practice in, they can access those restricted areas of the Congress site. And it is the same conversations, but because you're labeled as a patient, even though you are working professionally, you also can't enter those areas. And at EULAR this year, for example, there was a separate area where there was some meeting rooms where patient organisations could meet industry colleagues because it's an ideal opportunity for people to touch base, to discuss different projects that they're working on. But I was really baffled this year that the publishers, and I was dying to go and speak to some of the publishers to talk about co-authorship with patient authors and plain language summaries. And they were all at the back of the exhibition area, therefore I was unable to actually enter it. It was really frustrating. We got a little bit of a tour before the Congress started, and I could see them, and I was like, why are they there? So, I couldn't even have those conversations with those individuals. And we actually brought it up in the discussion that we had as a Congress committee afterwards when we were evaluating, and the feedback from the organisers at EULA it was really because of the concern that actually if we get caught with patients in that space, the Congress can be shut down, and it is that real fear. And specifically with the publishers, it was, well, there is advertising within the actual journals, and there's things we can do. We can actually take the printed journals away if that's the issue. But it is that reflection of actually the way that we view patients, and it's often from the people without that lived experience, is very different. And we do need to reframe that conversation because this can really damage the relationship between our industry and patient partners. And that's what we really want to avoid, without that clear rationale and that clear narrative as to what can and can't be done within the compliance guidelines.
Yeah, and I think you make a brilliant point about really making sure that the regulators are involved in that conversation, because I think that's the bit that's missing at the minute is reframing the patients and their role at the conferences, but making sure the regulators are brought into that conversation so we can start to change things. I just wanted to bring in a couple of the questions that have come in through on the chat, and you mentioned, Simon, about plain language summaries. And somebody's asked about these and the opportunity for translations. Can you just comment on what you've seen at conferences in terms of interest in plain language summaries to help to broaden that reach of the audiences and the patients who are participating?
Absolutely. And, firstly, we should be trying to make all of our posters follow better poster guidelines, and make them more accessible to people, but we don't always see that. So I think plain language summaries really can help to bridge that gap. And we see patients attending meetings, and when there are no plain language summaries available, they're actually interpreting posters and then reporting back to their communities as well. So a lot of that is happening already. But I think the more we can do to bridge that gap and make research more accessible to people, it's a win-win. But I think often we can get siloed, like within ISMAP. I think the ISMAP community is very proactive around making research more accessible. That doesn't always translate to in specific therapy areas, for example. So I think we always need to be mindful that there's still a long way to go to actually help health professionals realize that plain language summaries are a thing. Many are unaware. So I think there's been great movement within our community, but we also now need to think about the next steps and how we reach out to wider groups of the health community to bridge that gap.
Yeah.
Also remember that plain language summaries, yes, so traditionally plain language summaries are seen as, oh, they're for patients. Well, actually, it's for a non-scientific audience. So there's HCPs, for instance, where plain language summaries would be useful. health journalists, it would be useful, because I know that some pharma companies, for instance, start getting a bit nervous when we're talking about plain language summaries, because they say, oh, well, we can't do that because it's promoting to patients. Well, actually, no, it's about making it more accessible to a non-scientific audience. And we also have to ask ourselves the question, particularly now that we have open access, is it ethical to not do plain language summaries if you have an open access manuscript which is available to everyone, but not everyone is necessarily going to understand it? Then we run into the danger of people reading this information and actually, taking away the wrong things. So having these plain language summaries available, I think, really democratizes the information that's out there, and avoids this whole misinterpretation, or people mistakenly taking things the wrong way because they're reading information in a format or in a language that they don't understand.
Yeah, and I think with the growing interest in AI and generating plain language summaries in multiple languages very efficiently, we hopefully will see a lot more of this, and an increased in the democratization of the data. And Trishna, just to address another question, I just wanted to ask you a little bit about, you mentioned, the role of the patient representing a broader community. How do we make sure that some of the insights from patients who perhaps have had very negative experiences are also represented at conferences? Because we are, we have very enthusiastic and proactive patients attending conferences, but that's not everyone's experience as a patient. So, and often we learn most from people who maybe have had a negative experience. So how do we make sure that those insights are being captured as well?
It's again about making sure that that the patient advocates and the patient organizations are gathering those insights and those views, and then they can then represent them at those congresses. Because there are plenty of people out there who, yes, might want to have their views heard, but don't actually want to get involved in advocacy, don't want to necessarily be attending these congresses. So it's just making sure that you've got different ways of gathering insights. Yeah. But that you are then, as somebody who is going to a congress, making sure that you aren't that N of one, that you are fully representing the different views within the patient communities. And that also speaks to the diversity, equity, and inclusion side of things as well. So, yeah.
And it's a great point, because we are seeing more patient experience data based on surveys, etc., actually being published at these conferences and co-authored by patients, which I think is brilliant. Okay, so I think we're nearly at time, but I just wanted to, before we finish, ask each of you just one key takeaway, call to action for our listeners, our MedComms community, to really help to inspire them to drive patient involvement in conferences moving forward. So, Simon, maybe I'll start with you.
Oh, you're making me pick one, which is really difficult. I'm going to pick two. I think we need to have better visibility of patient involvement at congresses. So Trishna, myself, and some other patient co-authors and industry co-authors are presenting something at ISMAP Europe around looking at European congresses. And generally, we're really, really poor at documenting where patients are involved, how they were involved, and the impact that that has. So I think there's a huge scope there, because we need to help to demonstrate that to deliver change. So that's a real call for everybody on the call, whether you're a patient working in agency or industry or our congress organizers, to think more about what we can do and to push that needle forward. And I think let's have the conversation to everybody. If you're a patient, push for this is happening already. Let's have the narrative. And I think for a lot of industry colleagues, actually, you're in a position sponsoring some congresses to be able to have those conversations and help push that change to make conferences more accessible to everybody within a community, because that's where we really need to go to. So please don't give up.
Brilliant. Thank you. And Trishna?
So I just echo what Simon said, be the change. So the more that we get patients involved, the more congress organizers and governing bodies will have to evolve in order to reflect the reality. So when you're doing your congress planning, see where you can involve patient groups and advocates. start early so that compliance and legal can get involved to smooth out any issues before they occur, and question the Congress organisers about patient involvement, lobby for patients to be on organising and advisory committees. We as a patient community were already doing this, but the more voices in the mix, the stronger our case will be.
Okay, brilliant. So I'd just like to thank our two panelists who have provided some amazing insights. I hope you guys enjoyed it as much as I did. I apologize for those questions that we didn't get to answer, but obviously we are all available for you to contact us directly afterwards, and happy to continue this conversation. So thank you all very much.
Fantastic, thanks. And I'm just going to say a few words just to wrap this up, but thank you guys. That's the longest during a webinar I've sat and not said anything, so you'll understand it's been very hard work. We have run out of time. There's so much more we could talk about, but thank you so much for joining us. I'm just going to throw, because it's my party, I'm just going to throw one comment out, which you've touched on, but it's a soapbox for me. I know it's a bit of the elephant in the room. It's all very well, and people are worried about compliance and all the rest of it, but you've touched on the basic accessibility to conferences, but we could go into a lot more about that. It's a personal soapbox that a few years ago, the digital world started enabling us to do all sorts of things, virtual meetings, hybrid meetings. We could involve patients in ways that we couldn't have dreamed about, not much. And it worries me. And I think you've all sort of basically said the same thing in different ways. You've touched on the fact we're going back to in-person meetings, and in-person meetings are great, but they are by definition inaccessible to some people. And patients is an obvious group, but actually there's lots of HCPs and lots of people who can't participate in events. What gets me excited is the fact that you can involve people in these conversations in ways that we couldn't have done a few years ago. And I personally think it's really sad that that we don't all have that at the front of our mind, and then worry about the compliance issues. But let's make it more accessible. So look, as I say, that's my finishing point, just to throw out there and let people think about it. And you might just go, oh, he's a grumpy old sod, and that's his soapbox. But I think it's so, so very important. On that note, thank you very much for everyone who's joined in today and listened to you, because everyone can join in the way that we're doing this meeting. But please, again, as Dawn says, follow up. If you're watching this, follow up with these guys directly. They're all happy to hear from you. LinkedIn. And also, there's some really interesting webinars, recordings on this topic at NetworkPharma TV, where we've gone into more depth about some of these aspects. So go and have a look. But for today, thank you so much. Everyone gives us a little wave, and we'll wish everybody a good day. Cheers. Bye bye.